Hi, this is Dr. Srinivas. I'm an orthopedic onco surgeon and CEO of Prakriya Hospitals, Bangalore. Today, we're talking about cancer. When it comes to cancer, there are two questions which pop up regularly. How do we prevent cancer? And if there's cancer, how do we detect it early? Number one, how to prevent cancer? If you look at cancer, if you just understand the nature of cancer, cancer is nothing but cells multiplying without control. And this can happen to anybody at any age. And there are various forms of cancer and there are various causes for cancer. Most of these causes are still yet to be detected. We are contemplating on many things. Few things that we can do to prevent cancer is one, to lead a near normal healthy life. When I say that, basic things that we do, for example, drink a lot of water, eat natural food in a natural form, avoid deep fried items, avoid junk, and food, anything that is more close to nature is generally healthy. Avoiding stress. Stress has become a very important cause for cancer and many other diseases. Our lifestyles have become very stressful. We are determined from morning to evening, everything is determined. We are at a fast paced life. Our work is, we are under a lot of pressure at work. We are at a lot of pressure at house. And we have to relax, we have to learn to relax ourselves, take breaks, small breaks, take a break from work, relax your body. We can have a lot of yoga, meditation to relax your body. There are various ways of relaxing your body. You can read a book, you can go to meditation, you can jog, you can go to a gym. Whatever is suitable for you, you can adopt those techniques. The other thing that we can do is to prevent cancer and detect cancer at early stages. Now, how do we detect cancer? Generally, people who are about 20 or 30 years, they are more prone for cancer. Earlier, we used to say that patients with more than 60 years used to get cancer, but there are cancers which can occur in children, in adulthood, in early 20s, 30s and 40s. So, generally what we recommend is a yearly health check program. Generally, we have a customized health check program for women and men. So basically, what we do in the health check is we screen different parts of the body for various functioning of these organs. This can detect blood pressure, sugars and various other things. Similarly, we detect cancer. We do tests to detect cancer. For example, we do a chest X-ray. Sometimes we do a test specific for women and men. For example, for women, we do breast examination. We do mammography yearly once. We do ultrasound of the breast to see for any lesions in the breast. To see cervical cancer, basically we examine the cervix. We do what is called as a pap smear, which will detect if there is any cancer in the cervix. If there is a doubtful lesion in the cervix, the gynecologist will take a biopsy from that. For men, we do what is called as a prostate-specific antigens to detect prostate-related cancers. We do other tests, for example, CA19, CEA, which will detect cancers in the abdomen, intestines and things like that. If these tests are done on a regular basis, we can detect cancer in early stages. If you don't do these tests, generally we will not know what is happening inside the body. I remember a lot of my own colleagues who have had annual health checks. In fact, one of the doctors had a health check and we found cancer in the kidneys. Fortunately, this test was done and then we could detect and treat it very early stages and we could cure them. But generally, if you don't do these tests, these cancer cells will spread to other parts of the body, and when it spreads, the chance of curing these diseases is very, very difficult. So early detection is very, very important in cancer. I recommend each and everyone who is about 20, 30 to go for health checks, specific tests, so that they can detect, they can see the functioning of the body. We at Prakriya Hospital, we have a comprehensive health check program for different people and we have specialists to take care of them as well. Thank you.